Okay, back in 2009, I'm looking at a MRI report from your back. Oops, there, it got off the phone. And let me read this. Multilevel degenerative disc disease from L2 downward, with the worst level being L5S1, with a large left paracentral and foraminal extrusion, a combination of protrusion and a sequestered fragment causing severe narrowing of the left neural foramen and the anterolateral aspect of the central canal. In other words, a piece of your disc was bulging out so far it was hitting the nerve. And you had a radiculopathy down your left leg, right? Right. And numbness and weakness and everything. Right. Then they also noticed a new central disc protrusion at the L3-4 level with severe narrowing of the central canal. That means the bulge had pushed so far in that it was squeezing the spinal cord space, the space of the hole that goes down through the vertebral column. Tell me briefly what you experienced with my technique and how I changed all that with what, about maybe 2 visits in an hour's, maybe 2 hours worth of effort?
Yeah, the first visit, came in, you showed me some basic maneuvers on a couch and how to do at home, and just simple maneuvers on when you get out of bed, how to just drop your hips over the edge and just do some basic in-house maneuvering. And then you scheduled an adjustment session.
I manipulated your back, yeah, manipulation.
Manipulated my back, got that, and from that point going forward, you showed me just little techniques using from, like I said, the couch to the side of the bed to using pillows and just kind of simple maneuvering and adjustments that keep it back in place. I have no numbness since that time frame, no burning.
And you said a few minutes ago that it changed your life.
Oh,
how did that happen? How could
I went from
that's
being
a pretty
scared to work outside, to go ride bikes with my kids, to be able to just enjoy my life. I was worried that I'm gonna be out somewhere and it's gonna come out. I'm not gonna be able to just do anything. I'm gonna have to wait for somebody to come get me and drive me home. And now I'm at a point where I can actually enjoy life. I can be with my kids, my family. I don't have to worry about it because I know now, even if I'm out, how to use the back of my tailgate of the truck, how to use a couch, how just to roll up a regular pillow and a towel and put it under my back just to get it stretched out.
And you'd been to numbers of other doctors and even had them do the epidural steroid injections into your back. And none of that helped?
I had every painkiller. I had all the injections. The injections worked great for about 3 months. It took the pain away. Now my legs will always burn, but I could still move because it was just like, I call it a Band-Aid. It never really took away the issue, but it numbed the issue. So I'd have to go back every 3 months, deal with the pain of big needles going through my back, and it was scary.
Did anyone ever, along that time, the doctors you've seen, give you an explanation of what was wrong with you?
The only thing they had was what you just read there. Was just all these different big words. I had no idea what it was. That the only option to do this was surgery was the only way to fix it. And luckily, the doctors that I had at the time said surgery was something they really want to push off for a period of time. Luckily, that's what they told me. But I had a couple of them that said, let's go do surgery tomorrow. And I don't really like back surgery. It scares me. I don't know enough about it to know what to deal with. And but ever since, like I said, your manipulation and the little small details, you showed me how to do it, just small little steps.
So how long have you been now largely pain-free and back to normal life?
I came back, it's got to be close to a year now since I came in
Over
and
a
dealt
year.
with you, and now it's just minor on occasion, cold weather, or playing with the kids a little too rough, and I forget to watch myself. But again, just a little towel at night, stick it under my back, and while I'm reading a book for 20 minutes in bed, and just simple manipulation.
So I put your discs back in on my equipment in the back, and then once they were in, you're able to keep them in.
Yeah, I'm able to keep them in.
And you haven't had the pain down your leg?
I haven't had any burning, any sensations down my legs at all.
Where the piece of disc material on the MRI showed that it was extruded and pushing against that nerve. Well, it wasn't extruded, you see. I could prove that it wasn't extruded because I pushed it back in with my technique. And so you're one of the many beneficiaries I've had, but what I can't understand is why the world hasn't beaten a path to my door yet. Can you tell me why?
I'm pretty computer savvy. I went through the internet looking through different scenarios. I mean, I've seen some articles in catalogs and in books that said, buy this little plastic contraption and lay on it, but I didn't hear anything anywhere about your website. It wasn't until I drove by and saw your sign and saw back and just got lucky by picking your name out of the book for my insurance.
Well, you're a great testimonial. You wouldn't mind if I put this out for advertisement for my website, would you?
Permission.
Okay, thanks a lot. Appreciate it.